For navigators that are interested in learning more about what you can do and kind of the history that we've come from, where we can be part of positive change, I would refer you to a couple of resources. First, I would remind you that we have our no-cost team training available on the GW Learning Management System, and that provides a fairly succinct, about 5-hour, overview of past historical abuses, specific issues facing the Black community, the Latino community, and the LGBTQ community, and then interpersonal kind of communication strategies and advocacy strategies and system level strategies that you can take on in your practice to help create that positive change. So that's one resource, and that comes with free CE, so that's good. In terms of books, if you're interested in reading about some of this stuff, I'm in the middle of reading right now Harriet Washington's really excellent Medical Apartheid. It's not an enjoyable book in terms of the content, but it is very enlightening, and it's really kind of a history of medicine and how the medical establishment has kind of moving away from this idea that distrust comes because of Tuskegee. Like Tuskegee was it was a very long study and a very inappropriate study, but there are a lot of other things that have gone into the history of medicine and research in our country that has really earned the distrust of the Black community in particular. So I would highly recommend that book. Also, The Color of Law is a great overview of how kind of government-sanctioned housing differences occurred over the last several decades. Just Medicine I have not yet read, but that is next on my list. Also, How to Be Anti-Racist by Kendi. That's, a phenomenal book. So those are some resources that you could start with. In terms of the LGBTQ community, Fenway Health has a lot of learnings online. I mentioned the team training. There's a Fenway guide that's for practitioners if you want to have a reference book. And then the University of California, San Francisco has excellent primary care guidelines, including screening for the transgender community. So those are things that I would definitely refer you to.